Much for being here today. I am Maher Badri from CETIC. I'm with my colleague Nikolaos Matskanis. Both of us are project managers involved in TEF-Health activities from CETIC. We will present to you our institution, our role in TEF, and our catalog of service to help you in testing and validation your services. Who we are, CETIC, Centre d'Excellence en Technologie de l'Information et de la Communication. We are a non-profit organization. We are an applied research center. Our mission is to stimulate regional economic development by transferring skills and expertise in information communication technologies, in digital technologies to businesses. We connect academic research with the concrete need of the socioeconomic world by transforming academic results into practical and innovative solution to be used by businesses. Our researchers develop their expertise in a coordinated manner to respond to different technical challenges, such as software engineering, which includes the application of engineering techniques in software development and the application of these techniques on complex systems. Also, artificial intelligence, data management, data analysis, cybersecurity testing tools, algorithmics, combinatorial optimization, which aims at improving decision-making with good performance on complex problems. We have expertise in Internet of Things and collecting data. We are more than 50 researchers and have more than 150 business and R&D partnership, including 80 across Europe. Our innovations are applied in key societal domain of applications such as health, smart mobility, smart building, energy, manufacturing, and so forth. Within TEF-Health, we support startups and SMEs by providing access to virtual facilities. This includes services based on dataset, simulation environments, cybersecurity testing tools, as well as IoT testing capabilities. What problems do we solve for SMEs in our area of expertise? We know that development of AI-based solution in the medical sector is no small feat, especially for SMEs. The intersection of the highly regulated environments, the technical complexity, and limited resources presents a significant barrier for SMEs. One first challenge is accessing and managing high-quality data for training, validation, and testing. Healthcare data often suffers from a lack of standardization and interoperability, making it difficult to obtain relevant and representative and complete data set. Beyond data, AI systems must be robust, secure, and resilient to both errors and cyber attacks. And achieving this requires rigorous testing, something that SMEs often struggle to set up internally. Why it matters now? Because, as said by Guillaume, SMEs have to meet with requirements set out in AI Act, in medical device regulation, and in other regulation at the European level. And often SMEs show a lack of resources and a lack of expertise in AI, in machine learning, expertise in they don't have a deep understanding of regulatory. So this is why TEF-Health make it simple and easier by providing services on solution at TRL, so technology readiness level 6 or higher. The green highlighted area represent the coverage of or the perimeter of intervention of CETIC. As an applied research center, as I said, we can support startups and SMEs on solution at TRL 3 or higher, but within TEF-Health, we can support SMEs on solution at TRL 6 minimum. This is an overview of our catalog of services classified or that can be split into 3-4 classification domains. I will present the services I think could be relevant and could be useful for you through use cases, 3 different use cases. And the first use case is about support SMEs in deploying AI systems in real environment hospitals. So we know that deploying AI system in real environment is a complex project because it requires to have a compliance with a set of technical, of ethical, of organizational conditions, and as I said previously, SMEs can have a lack of resources to gather enter the disciplinary talents. So we can support them, for example, first of all, in accessing and managing data to obtain high quality data for training, for validation, for testing. We can help them, for example, in choosing the technical infrastructure that will be necessary to deploy their AI system. We can help them in making their AI system interoperable with the existing system within the hospital. We are, for example, familiar with the data exchange standardization, FHIR for fast healthcare interoperability resources. We can help them in integration, CI/CD pipeline with the integration of machine learning operations to make their systems robust and scalable. We are also familiar in privacy enhancing technologies such as federated learning, allowing AI models to be trained across decentralized devices or institution without sharing raw data. We are familiar also with other privacy enhancing technologies like homomorphic encryption, like differential data anonymization, data pseudonymization. So we can be useful on their aspects. The service 5 is to say that we in collaboration with our partners within TEF-Health, with medical staff, we can help SMEs in AI models testing and validation. So the second use case is about support in cybersecurity testing with the cybersecurity testing tools. As I said previously, achieving this requires rigorous testing. So we can help SMEs, for example, in scanning vulnerability, scanning the AI system by identifying the known vulnerabilities, the potential weak points that attackers could exploit. Our method is based on specialized software to identify secure flows, such as unsecured open ports, such as incorrect configuration or obsolete software versions. So once the vulnerability is known, we provide an action plan, a plan with a set of countermeasures, actions to help the AI system achieve the appropriate level of security. We have another kind of services. It's about providing risk analysis by identifying security risks and mitigate them and give support in with countermeasures services to put the AI system more secure. The third use case I will present is about our expertise in algorithmic in combinatorial optimizing, added with our expertise in AI data management. So we can model a hospital facility to best optimize processes within the hospital facilities, to assess the robustness of the facility under different operation conditions. Yeah, as an example, I will give this. This is a collaboration with CARNAM. CARNAM is an association between 3 hospitals in the region of Namur in Belgium. And yeah, and the association here, its mission is to concept, to build, and to operate sterilization facilities that will be shared by the three hospitals. So we started by collecting existing data that includes data documentation about tools, medical tools, data documentation about the workflow within the facility, historic data about the asset, and about, for example, the environment of the asset of the facility, like transportation, logistic, for example. Once the data collected, we conducted a simulation of different scenarii to assess how to assess the behavior of the facility under different operation conditions, and that help the institution here, CARNAM, in decision making, in investment decision, by providing different KPI, the occupation of the facility, and the behavior of the facility under different operation room. It's an example of use case. How to engage with us, as explained by my colleague Guillaume. So go on TEF-Health.eu, click on search for services, and you can filter either by organization or by service provider, and we will find our catalog of service. For any request or information, please contact us on this mail address. Yeah, a little word about the call process and what happens next. So yeah, you have to go on tef.charity.de and register, create a user account. Be sure you will find a comprehensive documentation there that will facilitate your experience through the website, the TEF-Health platform. Once the user account is created, please, yeah, if you find the appropriate service you need, submit your application. This is the first phase of the call process. The second phase is to assess eligibility of the request, by assessing if, for example, if the SME is located in Europe, if the SME can obtain state aid encore, yeah. So after this eligibility The candidature will be evaluated by our experts, and they will give score, and all demands or requests passing the eligibility check will be put with the in contact with the service providers, and we will have the classic phase of negotiation of contract setting up. So that's all for me. Thank you for your time. This is our contact information. Don't hesitate to contact us, and we are ready now to respond to your question, if any. Thank you.